Welcome to Learning Anatomy with Dr. Bakare. In this lecture, we'll be looking at the tensor fascia lata. Using this image by the side here, this is where we have the tensor fascia lata here, harrowed in black. This muscle is one of the muscles of the superficial gluteal region. In this lecture, we would be looking at how the fibers of this muscle originates and also where they are finally inserted upon. We'd also be highlighting the blood supply and the innervations of this muscle. So some details that you should know as students of anatomy. The tensor fascia lata is a fusiform-shaped muscle that is located in the anterolateral edge of the gluteal region, and we would be seeing why it is located in the anterolateral edge when we get to the origin of the tensor fascia lata. So using this image by the side, this is where we have the tensor fascia lata, and you see that it is positioned on the anterolateral edge of the gluteal region. Remember in our lecture on the gluteal region, we try to compartmentalize the muscles that are located in the gluteal region. We say that we have the deep layer and also the superficial layer. The deep layer, just as the name implies, is embedded deep within the gluteal space, while the superficial layer is seen to overline on the deep layer. Within the superficial layer, we have a number of muscles, and these muscles include the gluteus minimus. The gluteus minimus is what is highlighted here in red. It is the most deeply embedded muscle within the superficial gluteal region, and this muscle is seen to be overlined by the gluteus medius. The gluteus medius is what is seen here to be highlighted in green, and this is seen to be lying over the gluteus minimus. While we have the most superficially placed muscle, the gluteus maximus, that is highlighted here in purple, and this muscle is seen to be overlying on the gluteus medius. So you see that the gluteal muscles, the gluteus minimus, the gluteus medius, and also maximus are seen in layers, where we have the most deepest as the gluteus minimus and the most superficially placed as the gluteus maximus. Then if you go to the lateral edge here in the anterior region, you have the tensor fascia lata, and this is what is highlighted here in yellow. So this muscle is seen to be located around the anterolateral region of the superficial gluteal region. So if you try to list all the muscles that are located around the superficial compartment of the gluteal region, the tensor fascia lata, including the gluteus minimus, medius, and also maximus, are seen to make up the superficial layer of the gluteal region. And this is what is highlighted here in this image. So let's drive to the next slide, where we'll be describing in details how the fibers of the tensor fascia lata originate and also where they are finally inserted upon. So going to the origin of this muscle, tensor fascia lata is seen to originate from the anterior superior iliac spine and also the anterior part of the iliac crest. I've put up a lecture on the bone in pelvis. In that lecture, we highlighted in details where we have the anterior superior iliac spine and also the iliac crest. But using this image by the side here, this is where we have the tensor fascia lata that is highlighted here in yellow. We say that this muscle is placed on the anterolateral edge of the superficial gluteal region. So driving deep into how the fibers of this muscle originate, we try to use this other side of the bony pelvis. This is the posterior view of the bony pelvis. And around this region that is harrowed here in dotted black is where we have the anterior superior iliac spine. The anterior superior iliac spine, if you try to break down the name, it is located in the anterior part and it is superiorly placed. And of course, it is located on the ilium. So you have a projection that is referred to as the anterior superior iliac spine here that is harrowed here in dotted black. We say that it is anteriorly placed and it is also at the superior region. And for us to have the anterior superior iliac spine, we should expect that there is going to be an anterior inferior iliac spine. And this is what is also harrowed here in dotted black. So in the anterior region, we have the anterior superior iliac spine and we have the anterior inferior iliac spine. And because we have the anterior superior iliac spine, anterior there means there's going to be a posterior superior iliac spine. So if you go more posteriorly at this region, we have the posterior superior iliac spine. And if we go more inferiorly, we have the posterior inferior iliac spine. So this is how the names are being drafted. These are basically projections that are seen in both the anterior and the posterior region of the ilium. And this is why they are referred to as the iliac spine. And of course, they are positioned superiorly and also inferiorly. And this is where you have their names being drafted from. So if you go back to the anterior superior iliac spine here, that is harrowed up here in the anterior region, is where we have fibers of the tensor fascia lata originating from. And this is why we stated in our previous slide that the tensor fascia lata is anterolaterally placed. We also have other fibers originating from the anterior part of the iliac crest. This is where we have the iliac crest here above, and this is the posterior view. It means we'll also be having fibers of the tensor fascia lata originating from the anterior part of the iliac crest, which is going to be located at the front. So you have a number of fibers also originating from the anterior region of the iliac crest. So as they emerge from these two regions, you see that the fibers are directed downwards. So let's see where the fibers of the tensor fascia lata will be inserted upon. So as they drive downward, you see that they are inserted on the iliotibial tract. The iliotibial tract is a fibrous band that is located on the lateral region of the thigh. And you see the iliotibial tract extending from the iliac crest here on top and is directed towards the lateral condyle of the tibia. So you see that the tensor fascia lata that is highlighted here in yellow on this other end, you see that it is finally inserted at this point on the iliotibial tract. And if you see the pattern by which the iliotibial tract runs, from the name, it runs from the iliac crest up here, and the fibers are directed down here on the tibia. It is directed onto the lateral condyle of the tibia, specifically inserted on the Geddes tubercle. And this is what is harrowed there at this point. So if you go back to how the fibers of the tensor fascia lata insert, you see that it is inserted on the iliotibial tract. Why the iliotibial tract is seen to be driven downwards, where it is finally then inserted on the lateral condyle of the tibia. So you can try and deduce the relationship between the tensor fascia lata and also the iliotibial tract. And it is important that we highlight the relationship of these structures with the gluteus maximus. If you revisit our lecture on the gluteus maximus, we say that the gluteus maximus also has its insertion point on the iliotibial tract. Let's say this is where we have the gluteus maximus here highlighted in purple. If you go down here, you see that the fibers of the gluteus maximus is also inserted on the iliotibial tract. So you see that iliotibial tract is seen as an intercept between the tensor fascia lata around the anterolateral edge and also the gluteus maximus around the posterolateral region. So you see this acting like an intercept between these two structures. And this is what is projected here in this image. But all we need to know is that the tensor fascia lata, upon its fibers originating from the anterior superior iliac spine and also the anterior part of the iliac crest, they are finally inserted on the iliotibial tract. While the iliotibial tract also further drives down where it is finally inserted on the lateral condyle of the tibia, specifically on the Geddes tubercle. What is behind the iliotibial tract? You have the gluteus maximus. Gluteus maximus is also seen to take one of its insertion points on the iliotibial tract at this lower edge. So it is important that we highlight the relationship that tensor fascia lata has with these structures. And this is how it is projected here in this image. So let's look at some fun facts about the tensor fascia lata. And these fun facts will be explaining why the name tensor fascia lata is drafted. The tensor fascia lata is covered by the fascia lata. The fascia lata is a fibrous membrane that is seen to enclose the muscles around the thigh region. So it's like a deep fascia that is seen to surround or invest the muscles in the thigh region. After the pelvic region, at this lower region, we have the thigh region. And by extension, this fascia is also seen to cover onto the tensor fascia lata. Using this image by the side, this is where we have the tensor fascia lata here highlighted in yellow. So we have the fascia lata itself, which is a membrane investing on the muscles in the thigh region. And you see it extending up here, where it will also be covering also the tensor fascia lata. And we already highlighted in our previous slide that behind the tensor fascia lata, we have the iliotibial tract. This is the iliotibial tract here highlighted in blue. We say that when we break down the name iliotibial, it is a fibrous band that extends from the iliac crest above here, and this is what is harrowed here in black, and is directed inferiorly where it is finally inserted on the lateral condyle of the tibia. This is where we have the tibia here, and this is where we have the fibula here highlighted in green at this lower region. So you see that the iliotibial tract is finally inserted onto the tibia. And this is why it is so referred to as the iliotibial tract. The iliotibial tract is a modification of the fascia lata. So it's a thickened band that originates also from the fascia lata. This tract is seen to create a point of insertion for the tensor fascia lata. If you go back to how the tensor fascia lata originates, we say that it originates superiorly here from the anterior superior iliac spine and also the anterior region of the iliac crest. And you also see the fibers are finally inserted inferiorly here on the iliotibial tract. So this is the kind of relationship that exists between these two structures at this lower end. All these structures, including the muscles that are located around the thigh region, are enclosed by the fascia lata. And this is why if you have a contraction of the tensor fascia lata that is highlighted here in yellow, it's going to be creating an impact or a tense on the fascia lata that is highlighted here in dotted red. So this is why the name is being drafted as a tensor of fascia lata. So it tends to tense the fascia lata. So if you look at the relationship that exists between the fascia lata, which is the membrane covering over it, and also the muscle itself. So any impact that this muscle exerts is going to be concurrently impacting on the structure that is enclosing it. And this is why it is so named the tensor fascia lata. So it tends to tense the fascia lata. So it is important that we're able to highlight it, and this will help us to understand the basis behind the name, the tensor fascia lata. So let's look at the actions of this muscle. This muscle is seen to exhibit internal rotation and also abduction of the hip. If you look at the orientation of this muscle, where it originates from and also its insertion point, you see that it is seen to run across the hip joint. And this is where it is seen to exert these actions. It is also seen to exert external rotation of the nail joint. We say that the tensor fascia lata at this inferior end here, that is arrowed here in yellow, is seen to be inserted on the iliotibial tract, while the iliotibial tract finally will be inserted on the lateral condyle of the tibia, specifically on the Geddes tubercle. And because of this relationship that is created between these two structures, you see that the iliotibial tract is crossing over the nail joint. So this muscle, the tensor fascia lata, will be exerting effect also across the nail joint, which is going to be done through the iliotibial tract that it is inserted upon. So it exerts external rotation of the nail joint. It is also seen to help stabilize and also support the joint around this region. Also going to the blood supply of the tensor fascia lata is by the superior gluteal artery. It also receives contributory branch from the lateral circumflex femoral artery. The superior gluteal artery is a branch from the posterior trunk of the internal iliac artery, while the lateral circumflex femoral artery is a branch from the deep femoral artery, which branches from the femoral artery. And we know that the femoral artery is a branch from the external iliac artery. It is always good for us to always trace it back to the root, which of course makes it more interesting. Then going to the innervation, the tensor fascia lata is innervated by the superior gluteal nerve. We know that the superior gluteal nerve is one of the branches from the sacral plexus, and it specifically originates from the posterior divisions of the ventral rami from L4, L5, and also S1 sacral spinal nerves. So this is how the superior gluteal nerve would emerge and will be seen to provide innervation for the tensor fascia lata. Thanks for watching this video. Let's continue to stay glued to this channel.